Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Healius Cancer Clinic. So let me take this opportunity to talk to you all about parotid tumors. So what are these parotid tumors? How are they evaluated? How are they treated? So you might have seen patients with a tumor on the side of their face, usually in this region. So it is highly likely that this will be a parotid tumor. So what is a parotid gland? So parotid is one of the salivary glands. That is, the function of this gland is to produce saliva, and it produces majority of the saliva which is secreted in our mouth and is required for the digestion of the food. Many patients can have tumors in the parotid gland. This usually manifests as a swelling. Sometimes in more severe cases, it can present as paralysis of that side of the face because of the involvement of the facial nerve. Fortunately for us, most of the parotid tumors are benign. We have what is known as the pleomorphic adenoma, which is the most common tumor of the parotid gland, and it is a benign tumor. Most of the time it is harmless, but it still needs to be operated for two reasons. One, for cosmetic, because it's very obviously seen on the face, and second, it has the potential to become cancerous when it is there for a long time. Then we have a separate set of parotid tumors which can be malignant itself. So when a patient comes to us with a swelling on the side of the face, how do we evaluate him or her? So the most common test that we do is a needle test or a FNAC, in which a small amount of material is taken and sent to the pathologist to see under the microscope and confirm to us whether it's a benign tumor or a malignant tumor. We may also ask for an imaging of this region, usually by way of a CT scan or of an MRI, because this helps us to see where the tumor is located, whether it is going into nearby structures and such things. Now, usually parotid tumors are treated surgically. The benign ones require a surgery we usually call as superficial parotidectomy. The parotid has two parts, one a superficial lobe and the deep lobe, and in between runs the nerve known as facial nerve. The facial nerve divides and supplies the entire face on that half. So the challenge in performing a parotid surgery is to preserve the facial nerve, because if there is any damage to the facial nerve, there will be paralysis of that side of the face. Like I said, for benign tumors, the usual surgery performed is a superficial parotidectomy, where the part which is superficial to the facial nerve is removed. The surgery itself requires an admission for about 24 to 48 hours. The incision is planned in such a way that it is hidden. And it is cosmetically acceptable to the patient. And the challenge for the surgeon would be to preserve the facial nerve and remove the tumor entirely. A few parotid tumors may be cancerous. These require a slightly different sort of treatment, where the surgery also will be more radical. The entire parotid may have to be removed. And in addition, there may be other treatments involved like chemotherapy and radiation. Thank you.